In this video, I'm going to talk about observation charts of eCare pathways. So let's go to one of the patients and I'll explain what are the functions we have here. So we'll go to one of these patients and let's go to this patient. Okay, now if you go to this particular menu, if you go down here, bottom of the menu, you can see the summary and entry of observation is there. So I'm going to summary and I'll go to the proper observation one after that. So if I go to summary like this, now there's one observation template has been initiated here, which is the vital adults, which is a generic one available in any organization. And I'm clicking this one, then I can see the entries which have done in vitals. So this is, you can see this is blood pressure, these two values here, and then this is this blue one is saturation, and then we have heart rate and diastolic blood pressure, temperature, etc. Likewise, if you have more days here, that would be the chart would be shown according to the entries. And here, of course, you can see the other non-vitals which are recorded at the same time. So the vitals are fixed, but you can add more observation parameters around that. Let's say now here we have BMI, which is calculated according to the height and weight entries, and we have uh, sort of other parameters like GCS um, and pain score, etc. Whatever the things that you want, you can add into your template, and according to the entries that you are putting here, the graphic analysis will be provided. Um, and in this chart, of course, you can change the appearance of these charts. Let's say if I need to change this height into a sort of a column chart, so what I have to do, I have to select the height here, and then uh, going into changing whatever the things that you want, columns, and then edit, then generate chart, regenerate. So now you can see how it's changing. So yeah, so you can play around with these charts and how you can get the appropriate charts as you want, and then you can change the dates as well. The other one, it shows here the last entry details. Now this can be simply copied like this and paste into right click and go to copy, and then paste it wherever you want. And here it shows the entry as well. So entry module, if I go here now, this is the entry uh, page of these vitals. Now let's say if I need to enter a new vital, I can simply click this and then enter, then automatically get the current date 10 times. But you can change if you want this one like this, and let's say I want to put it as 6 p.m., which I did the vitals 6 p.m. That would be changed like this. Then I am going to put the parameters, like let's say I have to respiratory rate 18, saturation 94, um, and pulse and oxygen level was 0, which is not just Rumia, and blood pressure was 125, and uh, uh, that was systolic diastolic 85, pulse rate 89, temperature 36.5, and alert consciousness, alert, rhythm, sinus, save vital. So that would be saved. Then you can enter the other observation parameters. So you can put simply the whatever the weight that you want to put, let's say 2.5, something like that. Then you can put the height, 165. Then automatically the BMI will be calculated. So just save. You don't need to recalculate that value. All these can be configured once you're setting your templates. Now here already ready-made templates are there which you can use. And GCS 15, likewise. You can like pain score. Let's say we can put a pain score. Let's say this patient is having pain 4, okay, and pain score movements. Let's say 6. Uh, Feeling. I mean, likewise, you can keep filling these, but I'll just uh, stop there. And now the new entry is there. So if I go back to the chart, you can see the new values are recorded here, and you can see other observations, non-vital observation or other observations are recorded as well. Now this is the new recording. You can see how values are changed. So that's how you can use this summary. And let's say now if you want to, yeah, if you want to go into main summary module, you can just click and go there. Um, and or else if you want to go to the main module, you can go simply from this entry, observation entry. So it will direct you to the main module. So then here initially you can't see anything, but you have to go to the initiated observations. So once you have initiated vital, this would, well, let's say vital for adults, this would be here. So these vitals can be generated from any interface like outpatient or inpatient. I'll talk about that in a minute. So this is now you can see the table of entries and also the chart. Now this is the prolonged chart of this particular patient, because that was the initial one showed just sort of a time frame, but here there were other entries for a long duration, so that would be there. And then these are the other entry chart, so likewise. And let's say if I need to enter, then I have to go there, and this is just like the previous one I explained. So you can simply enter, click in this new entry, you can put new entry, or else if you want to just add or edit, let's say you want to edit this value, one of these values, let's say this is 37.5, then save. That's all. Then if you need to add, let's say you need to add feeling unwell here. So say vitals. So this is not saved. Okay, now this is activated. So feeling unwell, I'm going to put it to yes, something like that. Yep. Now it's changed, right? So that's your entry, main entry, and here the other one you have. You can put let's say now you are in a inpatient appointment. Let's say you are in. Let's go to one of the inpatient sessions. Let's through this one inpatient episodes. So you can go to inpatient observation as well. This is going to the same place, but that now you are inside an episode, inpatient episode. So if I'm going into vitals like this, and then you can see the vitals here. And what I'm going to do, I'm going to enter observation. At the same time, I want to put a note, right? While I'm putting the entry, let's say I have put a new entry. This is the new entry I have. And I want to put a note as well. Then what I have to do, just click this one. Then that would come as a entry or else a new note. which goes to the main progress note. So now here, let's say now observation is done, then impression, patient, patient stable. So something like this. Then I'll add main note. So now if I go into uh, the note, progress note of notes of this particular episode. Now, this is available, as I said, only in inpatient, but in outpatient, of course, there's no ongoing progress note, just one note is there. But here, of course, there's ongoing note. So then here you can see there's sort of multiple notes, progress notes, but this is like it's written in the timeline, or else it's written as a one of the progress notes. It's gone there because you need a observation as well as you put entry. Now, whatever the things that you're observing the patient, that would be recorded here. Yeah, so that's really handy. All right, so let's go back to our one of the patients. Let's say outpatient. Now, if I'm going into one of the outpatients like this, and then you can now, let's say if you're entering a record here, then there's these vitals are coming for the outpatient. Once you record this vital, actually this is recorded now. Here it goes into uh, this particular uh, generic observation observations that you have here. So now this particular one, let's say what's the date. I'll change one of them and see whether it's changing now. Here this is the date is uh, 21st of November. Let's try with changing this. Let's say we'll put this one as 180, something like that, 180, and I'll make the same like this. Then uh, going there into back to the observation summary again. So now I can see in the observation summary 180 is recorded here. This is that particular date. You can see. So likewise, it's like although you are entering the data from outpatient module, it comes to this particular observation panel. And the other one you can do here, go back there. Now, let's say you want to copy this last entry and put it into that particular node. It's simply just copy, exit, and go back here. Let's say you want to put it here and Control C, or else right click here and paste one of those, and you can format it as you want. That's it. Then if you save it, then that recording is there. But automatically this comes to your note, uh, but it's not really needed. What I want, let's say, if I just finalize this, let's see if I finalize this. Uh, Now you can see there's one vital here, and there's another one. Um, um, Additional information. It's here. Uh, where's the other? This vital has come there. Um, okay, and This is what it has got from the previous version. So let me have a good look again. Right, so let's finalize, save, and finalize, include vitals, finalize. Here we go. Sorry, I couldn't find it right. Now this is um, from from here, and the other one has gone from there. So ideally, it's not needed here because otherwise that would be duplicated. All right. So let's go back to um, this main data module again. I'll go to one of the inpatients. Um, and I'll show you how the ranges can be set for observations. Uh, let's say, yeah, so I'll go to what I'll do. I'll go to inpatient, and then I'm going into the observation of that particular inpatient episode. So now let's say if I'm getting this one, um, and this now here we have the chart of the combined kind of all vitals are there, but I can get the individual vitals as well, like this. Now these are individual values. I'll go in here. I can see this respiratory, saturation. Now these colors, of course, it's the range which shows yellow is um, uh, not not so severe, but it's some sort of problem is going on, and moderate here. This orange and some problematic in this area, and this is really severe. So likewise, there are color coding for according to the parameter values, and you can actually change it. Let's say in a COPD patient in the ward setup, we modify the vitals, right? So we do that because otherwise there'll be false alarm. Although patient is supposed to have that kind of low saturation or low heart rate, low blood pressure, and things like that. So let's see how you can set it here. So now I'm going into show details here. Now you can see here, of course, it shows what are the default ranges. Now, if I want to add a new range, what I can do, I just add update like this. Then I'm going into add new, and then I'm going into let's say oxygen saturation. Let's say this patient has COPD. I want to set this one, and this is going to be and set the effective duration. Let's say it's kind of starting from here to tomorrow. That has to be evaluated tomorrow. The range. Uh, so what I'm putting here, let's say I'm going to just copy the same values as here for alert range and um, alarm range. This is actually saying well how to alert. Probably we can reduce this one to 86 something, and then here this value has to be reduced to, let's say, 82, and sorry, here it's 82, and here it's going to be let's say 82, 83, and 83, 87, 88, 90, 92, 91, 93, 92, right? So if the saturation is more than 92, yeah, that's fine, right? So then You can put a comment if you want. COPD there. Save. Now the new range is set. Now it gives the time duration for this new modification. Now if I go back to graphical presentation, now you can see if I go a little bit down, sorry, if I go a little bit down, now the modification has happened and it gives the new ranges according to the modification I did. So the this calculation is going on as well. Now I can show you. Now it has calculated the score here. Let's say now here of course it shows what's the score. Score is 1. Likewise here score is 0. Now if the values are getting really problematic, the score will rise. Um, then actually it gives the indicator to the care provider to trigger a sort of a mid 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 call, or sort of asking for, deteriorating, patient is deteriorating, asking for the team to come and see. So likewise, the score will be calculated according to the ranges that we have given there. So that would be modified according to the ranges that we are modifying in this section here. This is the section, this modification that we have done. Yeah. So that's range modification. And the other one I wanted to discuss in this observation section. Um, how to set new observations. So let's say now I'm going back to one of the inpatients. Let's say now this patient has, I will go to a new patient. Let's say we'll go to different patients. Last name is get habit. Now this patient, there are more than one observation templates. So let's go here and I can show you summary. Now, there are different templates. Now, this is the one actually we have used for vitals. This is the generic one. And there's neurological observation as well, which has captured some information. If I go to entry, you can see what the entries we have, like this, GCS, pupils, etc. And then there's another tool that we have trialed here. This is NSKI assessment. This is mainly for spinal cord injuries. So you can see the values there. And if I go back to the chart, and it gives the chart according to that. So now this is actually can set according to your requirement, and all these parameters can be captured. And if you need to have calculation around that, that can be set as well. There will be a different module which is actually talking about how to set, how to configure your own observation charts, and how to uh, make the calculation around that. Yeah, so this is how the observations are captured and shown in eCare pathways.